Hello, and thanks for joining us for this brief conversation on the importance of understanding health coverage at key transitions in health care. And this conversation is geared more towards the parents and family members in the room. I'm Brynne McBride of ABC for Health. And before we get started, let's lay out a couple learning objectives for our conversation. We'll first want to understand the importance of knowing the basics of health insurance for your child, learn when we should be thinking about health coverage, and learn where to go for a little bit more information. Now, understanding transitions is the key to getting this conversation started. Healthcare transition is the process of getting ready for healthcare and coverage as an adult. But transitions happen all throughout childhood and all throughout life. From turning 0 to 1, from turning 2 to 3, from maybe entering school or maybe leaving school or turning 18, and in some instances turning 19, transitions happen across the age spectrum. Think of senior citizens too becoming eligible for Medicare once they turn 65. We will be thinking about care and coverage transitions throughout our own lifespan. Today we're going to point out a couple key transitions to think about your child's lifespan, and we'll start with age. But before we're done, we're going to hit on a couple other ones to keep in mind as well. During childhood, parents and or family members do help manage medical needs and payment for their child's care. And you're probably nodding along as I say this. There are a lot of decisions that need to be made. There's a lot of questions to be asked, and there's insurance, and there's money to figure out when care is delivered. Parents and family members are often the drivers of that conversation along with their own children. But as youth get older or as family conditions change, proactive steps are required to avoid gaps in either care or coverage. Why is it important that you understand your child's health insurance? First of all, to get the most out of it. Let the coverage help you better manage your child's health care, whether it's emerging conditions, ongoing needs, the emergence of chronic conditions, or whatever that might look like in your family. And to take advantage of preventative care. A lot of times people leave care on the table. They leave coverage on the table. They don't know it's available. Start understanding the coverage that's available for your family so you know how many visits you can have to the doctor or to a therapist or with a school-based therapist as opposed to a community-based therapist, and what kind of immunizations might be free along the way or other checkups that might be part of a preventative package. Why else should we understand health insurance for the family members or your children in your home? To avoid surprises. This one we really should have put first. Nobody likes to get a bill in the mail they weren't expecting. You need to understand the costs associated with care. What will be out of pocket? What will be in the premium? What other costs might be associated with the care visits your child is receiving? What networks do you need to stay within? Surprises sometimes happen when you get a referral to a physician that is out of network and necessary steps have not been taken to secure the appropriate coverage for that out of network physician or provider. Start talking about coverage in advance. If you're thinking about the coverage when you're thinking about the care, their chances of being surprised are greatly reduced. Know what coverage transitions to watch for. And then again, remember, age is the driver for a lot of these. Why understand insurance? To be connected, to establish a medical home for your child or for the teen in your home, and to create a better relationship with the primary care provider. And this is for you and your child. You should have a great working relationship with the provider, and so should your child. Being connected and having these open conversations will be key to that. Now, providers might not have all of the answers on the coverage piece of the conversation. They should be able to direct you to someone that can help finish that conversation, however. Why else understand health insurance for your child or family member? Because there is a lot to learn. We've touched on a couple of things already. Types of coverage, best coverage for your child or family member, cost, network, covered services, and the big one, you can have the information in front of you, but you do need to take a look at it and make sure you understand it. A lot of times the insurance paperwork is pretty thick and difficult. Try to get some assistance reading through that if you don't think you can do that on your own inside of your own household. And finally, to take charge. You can do this. Know your rights and responsibilities, know the rights of your children, and they should start as they get older, start having a better understanding of their own rights and responsibilities as young adults engaging in a direct relationship with their healthcare provider. And a little bit of knowledge about insurance can go a long way. Start taking charge of these conversations now so it just becomes easier to have the conversation later. Now, I did say before that we would talk about other key transitions, and age has been the big one. When a child is turning 18, or in some instances 19, and they're losing their existing coverage, they will be thinking about health coverage as an adult moving forward. But other transitions happen. Income transitions. If the household income goes up or down, that could mean a change of insurance. If somebody gets a job, if your child becomes a young adult and gets a new job, employment could mean a change in health coverage. Service changes, immigration changes. If you're moving networks, adding a family member, either a birth or adoption of a child, could all have consequences on coverage. And that's why we have these conversations together. Again, to make sure that we're prepared, there are no surprises, and so we have a better understanding of the coverage moving forward. Now, you can also go to a couple more places for some resources. Healthcare.gov, the Kaiser Family Foundation, Families USA are some national websites and organizations that help provide information on healthcare and coverage. But we also have some great local resources right in our own backyard. Family Voices of Wisconsin, Parent to Parent of Wisconsin, Health Transition Wisconsin, and Got Transition. All of these have great resources, great people, and websites that you can reference to get more information. You can also check out our website at abcforhealth.org or healthwatchwisconsin.org to learn more. Thanks for joining us.